Let's talk about your aftercare following a skin resurfacing treatment, such as plasma resurfacing, laser resurfacing. The basic idea is that you really want to keep that area really moist, and you're going to have the emollients that we're going to give to you that will help you do that. The first day following the procedure, you're already going to have enough moisture on there. You're not going to want to be messing with it or touching it. By the next morning, you can go ahead and take a good shower if it's not bothering you. If it's bothering you, you want to go and wait and delay that. The key with this is that the skin is going to start peeling off in little pieces here and there. It's going to turn brighter red here, lighter pink there, little this there. It's going to be a patchwork, and that's all normal. I just want to reinforce that to you, that is completely normal. The key with this is that as you're cleaning it, the old skin will be coming off. Don't worry about that. Just don't aggressively remove it. It'll come off by itself. As you clean it gently with the prescribed products that we have, right after you've cleansed it, go ahead and put the emollients back on so that there's a thick coating. If you question, how much should I put on? I will show you in the office. I usually see you a few times that week, but put more than you think you need. I mean, it's better that you put more than you put less. If there's any question, did I put enough on? Put more. I want a thick coating on that area. As we progress over the week, as the skin starts to heal, sometimes what I'll do is there's a lighter emollient which you can use. That particular product we can then put over parts of the face where the skin is already healed. And if you say, well, what parts of my face, that's why you come back and talk to me, so I can help you with that as we progress. The only thing that I would be concerned about during that week are a few things so that you can think about. One is if there's a little bit of scabbing going on, there could be a little bit deeper treatment in that area. If that occurs, I should know about it. You're going to see me anyway in the office, and those little scabby areas are just a deeper treatment. And the way that you would treat that would be taking some of those cotton pads, taking a half a tablespoon of white vinegar and a cup of distilled water, and letting it soak that pad, and just letting it soak there several times a day to let it slough off the scabbiness. That's like a golden crust if that occurs. It's pretty uncommon, but I've seen it a few times. And then you want to really keep a thick emollient over that area if that occurs. The other thing I would be concerned about, you would be a area around the mouth in particular where you could get a herpes type of infection, which is little types of little vesicles, little clear areas around and clusters around the mouth. If that occurs, you want to double your dose. You're usually taking 500 milligrams of Valtrix or Fanvir. You want to double it to 1,000 milligrams twice a day, and then you want to call me. I really do. I want to know if that happens. It should not have a problem in the long term, but I just like to know about things if they occur to you. Even on the weekends, just give me a call. The other part that can occur, which is extremely uncommon, I've probably seen 1 or 2 cases of this, I think 2 cases I can think of, whether you can have a yeast infection or a bacterial infection. That's why you're on your antibiotics for the week. Other procedures, I really don't use a lot of antibiotics, but for the skin resurfacing, I do use an antibiotic. If there's a burning sensation, something is not right, please let me know. That could also be a dermatitis. During that first month, remember, you don't have that outer stratum corneum, that layer of skin. That is so that you can easily get dehydrated, so you want to keep that lighter emollient on after the new skin heals, and you want to keep that going for the first 30 days. Remember also for your first 30 days that you're more susceptible to an allergic dermatitis. That would be after a product is introduced, about 48 to 72 hours afterwards, you can get an itchy, burning redness where it can even look bumpy in that area. If that occurs, just please call me. If you can't get a hold of me for the short run, you can also get 1% hydrocortisone cream over the counter and place it over that area, and also take some Benadryl and Claritin to manage it as well. That's very unlikely, but if it occurs, that's something else that I should know about. I do want you to call me even on the weekends or the evening if that occurs, so I just know that it's occurred so that I can help you through that process. So those are unlikely things that can occur, but just for things that you could watch out for after your peel plasma laser treatment. There's one more thought that I forgot to mention, I think with enough clarification in the video, in this video on skin resurfacing. As all new skin forms, I always want to mention to you that I sort of own your face for 30 days. And then what I mean by that is I want you to be as safe and as gentle as you can with products. No perfumes on here. Even if you've been using Clinique or whatever product for 30 years and you decide, you know what, it's no problem, let me go and just put it back on, you could have a problem because your skin is very, very sensitive for the first 30 days. And then after that, you generally speaking are more resistant to have a dermatitis. As we mentioned, the dermatitis is an irritation or inflamed area. The way that I would help you minimize or prevent this problem is twofold. Number one, what I want you to do is to do a test patch when I give you my blessing, which means taking a little bit of your makeup product and just applying it over to the area that's after my blessing, usually about a week. Test patch a little area and give yourself 48 to 72 hours before you put it over the whole face. The reason that little test patch is important is if you get a dermatitis, the dermatitis usually appears about 48 to 72 hours after makeup application or whatever application, and I want you to not get a big allergic reaction. I want you to test that. Give it 48 to 72 hours if possible before you apply it over the face. The other recommendation I have for you is thinking about the proper makeup that you can apply to minimize the chance of an allergy. We have mineral-based makeup in my building here that we can get you involved with. It is an extra cost for that, but that's something you may want to even think about before you start the procedure. And that is something that would just minimize a chance of an allergic reaction. As I said, even if you've been using a makeup product for many, many years, it still could engender an allergic response in the first 30 days only because your skin is different in the healing phase for the first 30 days. One more thing in regard to plasma, the little bit of pinkness to your skin, you could still have a little bit of pinkness even up to 30 days, and that's normal too, even slightly beyond that, but not much beyond that, and even up to 30 days is not that common. Hopefully those small refinements and thoughts will help you during your healing phase. And if there's any questions, I encourage you, please just give me a call. Call my staff, weekends, night, doesn't matter. I want to answer your questions and want to help you through this process.